Hello, my name is Ezra Davidson, and today I'm going to talk to you about selective and performance bias in research. Bias is when a systematic error occurs because an outcome is favored during research, preventing the objective analysis of a question. This can occur at any stage of the research process, and the degree of bias must be considered, rather than viewing bias as a dichotomous yes-no value. This should give an indication on whether the study is reliable and any results are valid. Selection and performance bias. A prevalent bias that many researchers must be aware of is selection bias. Selection bias is a critical error, and it is involved when researchers choose their study groups. Errors in selecting who was chosen to participate in a study and who was not can heavily skew results. Selection bias can result in systematic error. Another common bias is performance bias, which researchers must look out for. Biases, however, can be effectively minimalized by not focusing on a single location or social group, recognizing the researcher's views, and working in a group. Selection bias. According to Notaras and Tugwell, risk of selection bias is often gone unreported. In trials with unequal randomization, it is said that over half did not report the randomization ratio, while over a quarter did not consider the unequal randomization in sample size calculations. What is desired in a study, however, is a clearly defined population that is at an increased risk of the study's outcome, while still being both reliable and accessible. Selection bias happens when the two study groups have a criteria for organizing subjects that is inherently different. However, sometimes in a study it's unavoidable, such as when comparing the health of night shift workers to those who work during the day. Health problems may be due to low socioeconomic status, which causes the subject to take night shifts, rather than the night shift being the cause for the health problems itself. For observational studies, a good way to minimize selection bias is to include as many subjects into the study, as well as organizing people in their specific groups accurately. However, experimental groups are much better at reducing selection bias, as people are randomly sorted into the intervention and control groups. To minimize selection bias to the fullest extent, people must be truly randomized, and the sample group must be an accurate representation of the population. Performance bias. Another common bias is performance bias. This generally involves the study groups being given different care or being treated differently. As a result, people knowing they're in the intervention group may exhibit greater effects, while those knowing they're in the control group may show lower effects than expected. Furthermore, patients may also be treated by healthcare providers who know the group allocation. To prevent skewing results, patients and researchers are often blinded, so neither know which group of subjects has received the intervention. This is known as a double-blind study. This way, raters and patients alike will not inadvertently overestimate or underestimate scores and lower the validity and accuracy of the study. Bias is a prevalent issue that many studies have to take note of. Systematic and performance biases must be controlled to keep a study both valid and accurate. Randomization and blinding are effective ways to minimize bias, but it cannot truly eliminate it entirely. As a result, researchers must include in their studies an estimate of potential error. This will ensure results are reliable.